Hi, it's Dr. Herman here. I am with a patient of ours. This is Carmen Sanchez. She lives here in South Florida, and Carmen has suffered with fibromyalgia. At least that's what the doctors called it for her, fibromyalgia, and a thyroid problem called Hashimoto's hypothyroid. And she has suffered with a lot of pain, which she'll be able to tell you in a moment. Carmen's been coming in for treatment now for about, we're probably about 7 or 8 weeks into the treatment, and her treatment has included a complete metabolic system workup, a whole diagnostic set of diagnostic tests, from stool analysis to blood analysis to saliva and hormone and so on. And we have changed Carmen's diet to fit her specific dietary needs according to her blood and her stool analysis, and she is under a very unique brain-based therapy program here in the office. Let's introduce Carmen. So, Carmen, you've suffered for many months with this, and you've gone to many doctors, and you were not getting relief.
I suffered for many months this specific pain, but I had suffered before with a lot of pain in my shoulders and my neck until I was diagnosed fibromyalgia last year. And my primary care doctor prescribed one of the 3 drugs that are for fibromyalgia. I didn't get any better. I kept going back to him because I was in a lot of pain, and he changed the pill to another one.
And those pills, I'm sorry, the pills were Lyrica?
Lyrica first and Savella.
Savella, okay.
So the only one that I haven't tried is Cymbalta, and I won't try it. I was on Savella and it didn't work. He increased the dosage of Savella and it didn't work. I went to a rheumatologist, I went to an endocrinologist, thinking that that was the physician that was going to help me, because I had heard, I had read that this was related to the central nervous system. So I said, okay, if I have that, a neurologist should help me. Just to find out after that visit that his recommendation was to drink a lot of water, and that he couldn't help me, and he was going to refer me to a colleague. When I went home and I said, that's it, I'm not going to any more doctors. I have to do what I've read everywhere. I have to live in pain. I have to get myself, to the idea that I'm going to live in pain the rest of my life. But Dr. Herman kept sending me emails. When I first registered in the website, he started sending me emails about fibromyalgia in details, what it is, what could be the cause, and what his approach to it is, and why it is different than the approach of many, many doctors out there. And it took me a while for him to convince me until I saw a video. And I said, I have nothing to lose. The first visit is free. What am I going to lose? I'm going to see him. And I came to see him, and from that first visit, at a glance, he saw in my lab tests that there was a serious autoimmune disorder with me. None of the doctors that I had gone before, which had the lab tests in front of them, were able to get to that conclusion. So he looked at me and said, I can help you. I know that I can help you. And I felt immensely relieved that there was somebody out there that understood the condition that I have, which I thought to begin with was not simple because of the many, many symptoms that I had. My digestive system, problems in sleeping, the anxiety disorder, problems with breathing. There was a number of pains everywhere. But when I'm telling pains, a lot of pains that could be very sharp, and they are like burning, and there is like a knife, like it's killing you. I couldn't sleep at night, and while I have been under his care, my condition has improved tremendously. On my own, not by him, not by his suggestion, but on my own, I've been on a small doses of that pill, and I will be getting it out of my life.
Because you're weaning off of it. Yeah.
Yes, because they don't help. What has helped me is his therapy. And I've been tested more than any other time in my life, and I am very happy because I can see the results. Not only the level of pain decreases, but the anxiety. When you are in pain for so many hours, you feel nervous, you feel very strange, and all those symptoms are relieved with his therapy. So I didn't get to this level overnight. I know that's gonna take a while, but I know that under his care, I'm gonna recover my health.
The first day, thank you. The first day that I met you, we did a basic for me, but we did some functional brain tests.
Yes.
And
that was a miracle. That was like a miracle, because it relieved me the pain for 5 days, and I couldn't believe it. I just couldn't believe it that the therapy that I had been under relieved me for so many days. It was the first time that I was relieved from the pain for so many days. It was like a miracle.
Yeah, that's incredible.
It was incredible. Like, it's incredible. There's so many times that I have come after that the pain comes back, and he again performs some kind of therapy, and I am relieved. Everything is.
And these are definitely different therapies.
Yes.
Something you've never heard of before.
No.
And something that's hard to describe to people who ask you.
Something that I've never seen before, that I never heard before. His approach is totally comprehensive, and it's going to get to the roots of it. It's not only gonna solve the pain for you not to have it, but you learn your systems, you learn how to manage your food according to the problem that you have, because everybody is different. And under the plan that I have, my digestive system has improved 100%, and I feel great.
How frequently were you not able to go? What was your pattern before with?
Oh no,
function?
Once every 2-3 days.
Once every 2-3 days you could go, and now?
Every day.
Every day.
Yes.
Sometimes twice a day.
Every day.
Every day.
It's very satisfying, because I know that my digestive system is working much better than before.
Yeah. And you couldn't even walk. If it was like a spike going up your leg, right?
Yes.
You felt like you couldn't even step on your feet.
Yes, and my not only my feet is a is a case here, but it's my foot. It was my arm, my neck, my shoulders, everything, my muscles here, everything hurt so much. I couldn't move my head. I had to go to an acupuncturist, and the acupuncture relieves the pain, but it doesn't go to the root, to the cause of why you have that pain. And that is what Dr. Herman does. He goes to the reason why your system is not balanced, your brain is not balanced. And we are working on my brain. People don't believe me when I'm saying we're working on my brain now. I couldn't even believe it one day when he says, we have to fix your brain. I said, you're gonna fix my brain? He says, I said to him, this is the first time that I've in my long life that I visit a doctor that says he's gonna fix my brain. And you know what? He's fixing my brain. And I'm gonna have it fixed for the rest of my life.
That's right. Very good news.
I will.
Thank you.
You're welcome.
Okay.
Thanks to you.
Yes. And so, again, we're inviting you into the office because you deserve to be well, and you don't deserve to be sick. And the doctors out there, the medical doctors, some of them are good, but let's just say that most of them just don't get it. Most chiropractors don't get it. Most therapists just don't understand this complex condition that people are dealing with. So we have a very comprehensive approach, neurologically, metabolically, that will figure out which pieces of your puzzle are the problem, and we can help you. So thanks for your time.